And so to do that, we're going to talk about a framework called the behavior change wheel. So as a, this is just one of the many frameworks that are out there. In a short 2-day course, it's not possible to introduce you to every framework. And the reason we've picked this one, we'll talk about sort of as we go through. All right, so the objectives here are to recap some of what Luke discussed in the symposium related to why we need intervention development frameworks, then introduce the behavior change wheel framework, and then understand how to use it to define and understand the target behaviors that you're going to be addressing. Right, so we talked yesterday about implementation really depends on stakeholder behavior. If people were doing what you wanted them to do, there wouldn't be an implementation problem, right? So you either need to change what patients are doing, providers are doing, health policymakers are doing, health organizations are doing. So in the end, really this is either an individual or organizational behavior problem. So changing behavior, in order to change it, then we need to understand why current behavior is happening, right? If you don't understand why patients are doing what they're doing, why those who are 25 to 45 are not coming for circumcision, then you're really, you're not going to sort of come up with the right strategy to sort of target that behavior and close your implementation gap. This is kind of an overall framework for the way that I think about sort of designing implementation strategies. We start with a health problem, right, like we all talked about. We start to understand what are the behaviors that are involved that are contributing to that health problem. What are some of the environmental factors that are involved that are contributing to that health problem? And by environmental factors, like anything from policies, available resources, health system level problems. What are the determinants of those behaviors, right? What are the determinants of these environmental factors? And then we're going to design an intervention that targets these determinants, right? Rather than just pick out of the hat, we're going to use SMS reminders, or we're going to use counseling or treatment supporters, right? We're really going to pick things that target what we now know or think are the determinants of the key behaviors or the key environmental risk factors. And then when we study that new intervention or strategy, we're not just going to measure whether it improves the health problem, but really try to understand, does it modify these determinants? Right? So that will help us understand, is it because, say that this intervention improves the health problem. Well, did it work because it actually worked like we thought it would? It addressed these things? Or did it just happen to work for reasons we don't understand? If it works for reasons you don't understand, it may not be, you may not be able to reproduce that in other settings. Right? If the intervention didn't work, right, is it because it didn't actually change these determinants, meaning that it wasn't effective in doing what you thought it would do? Its dose or its intensity wasn't enough. So I think this is some of the difference between what operations research has traditionally been and what I think implementation science is trying to do in order to get to a more generalizable place, right? We're really trying to understand why interventions are working or not working in particular contexts, and whether or not they're appropriate for other contexts based on whether the determinants in those new contexts are the same or different, okay? So this is how we start hopefully building toward more generalizable knowledge about implementation. Right, so Luke went over this earlier. So how do you do all of this? How do you gather all this information? Well, you don't just figure out a bunch of things and figure out how to use it later. Instead, there are planning models and frameworks. And these are sort of, I think, one of the unique contributions of implementation science is drawing from other fields in order to help intervention designers move through a step-by-step process for intervention development. They incorporate the use of theory at almost all stages in both understanding the problem and figuring out which interventions you want to do, and then how you evaluate those interventions. And we'll talk about how theory is introduced. So the framework that we're going to focus on is called the Behavior Change Wheel Framework. The reason that we picked this is that this is based on a synthesis of 19 prior frameworks that existed. So the folks who developed this looked at all of the other frameworks that had been developed to date. They thought that none of them were comprehensive, right? Few of them were conceptually coherent, meaning that they had overlapping constructs. So they talked about the same thing in different ways rather than specifying kind of unique things that contributed to intervention design. And then few of them were linked to a general theory or model of behavior change. So for example, some frameworks were specifically related to developing smoking cessation interventions, right? And the theory that was used was really specific to that situation, right? And so they weren't really generally applicable. So the proposed advantages of this framework are that it incorporates all of the key distinct features of prior frameworks. It is linked to a general behavior change model or theory that can be applied to almost any context or setting. And it moves from just identifying what the barriers are, right, to identifying concrete, like distinct functions that your intervention should serve in order to target the barriers you identify through your behavioral analysis. Right? So it's not just about what are the barriers, but what are the interventions that are likely to be effective based on evidence, based on theory, for overcoming the barriers that you've identified. This is the diagram, which I don't like, that they've put together for the behavior change wheel. At the center is this model of behavior called the capability, opportunity, and motivation model, which Margaret will discuss in the next lecture. So this is at the center because these are what the determinants are, right, the behavioral determinants that we talked about. Then based on those determinants, you want to select one or more intervention functions that are effective at addressing the specific determinants you identified. And then each of these functions can be delivered in various ways, right? So for example, education can be delivered through a guideline, by publishing a guideline. It can also be delivered by changing how service is provided, for example, by requiring a certain amount of CME, right? So that's what these are. We'll go into each of these in detail over the next few lectures, right? So but this is just a general schematic. One point I want to make that's often a point of confusion is that it's not that these align with these functions. So this wheel turns, right? So that's what I think is misleading about this diagram. It makes you think that certain functions are related to these, but there's actually no relation between this rim and this rim, right? So that's just a point of clarification. So in terms of using the framework, these are the steps that one would go through. I think I want to say up front that we're going to do all of this in a matter of 2 days, right? This is, a couple of years of work in reality, right? And so it's not that you just sit at your table and go through these steps on your own in your head or with a small group of people. There's a book called the Behavior Change Wheel book that helps people walk through. That's, I think, this one here. It's available online, either in online format as well as a paperback format. But, I think we're going to ask you guys to go through these steps, right? But it's really just an exercise. In reality, you would use a lot of data collection, quantitative and qualitative, to actually move through these whole steps. But the steps are first to understand the behavior, and that's what the focus of the 2 lectures this morning are going to be on. And then to identify the intervention options to target, the barriers that you identified. And lastly, to figure out exactly what the content and implementation of those interventions is going to be. All right, so step 1 is define the problem in behavioral terms, right? So what we're trying to do here is what behavior change is needed, right, to achieve the health outcome of interest, right? What do you need people to do? Right? What's the target individual, group, or population involved in doing the behavior? And what are the specific behaviors involved? Right? Those are the questions we're trying to answer in step 1. So let's take a problem, right? Too much traffic. Okay. Is that a behavior? It's a problem, okay? So what are some of the behaviors that might contribute to too much traffic? Buying cars. Okay, so building bigger roads. That's actually true. It's counterintuitive, but
if everyone in the family has their own car.
Yeah, so people buying multiple cars, right? So there's a number of these. That's car purchasing, car use, right? Failure to use public transportation. All of these are specific behaviors that contribute to the problem of traffic, okay? Okay, so another one, high rates of obesity, right? Again, a rate of obesity is not a behavior, right? That's a problem, right? Some of the problems that might contribute to that, right? And maybe you want to promote weight loss, right? That's the behavior you want to achieve in order to reduce obesity rates, right? But that's also not that specific, right? So what are the specific behaviors that might be involved in promoting weight loss? Exercise. Okay, what else? Sugar intake, eating habits, right? Exactly, right? So, you need to be, so what is it you want people to do? You want them to increase their physical activity or reduce calorie intake. So why is it important to go drill down like this, right? In order to understand what the barriers are, right, you need to know what you want people to do. If you don't know what you want people to do, how can you figure out how to make them do it differently, right? So the more concrete and specific you can be about what you want them to do, the more likely you are to be able to figure out, what it is or why it is they're not doing what you want them to do. Okay, and you can even be really more specific than what we've outlined so far, right? You can say you want to increase the amount of walking, or reduce the consumption of high-fat foods, or reduce the time watching television, right? So again, the more concrete and specific you are about what you want people to do, right, it's better when you go and do your qualitative analyses, right, to figure out what the barriers to that behavior are. All right, so high infection rates in hospitals. This is a common concern everywhere, right? So again, infection rates are a problem, right, not a behavior. So what are some of the behaviors that might contribute to high infection rates? Hand washing, good. What else? Right? Sorry, overcrowding, right? Yeah, so, so there's a number of things. So you even say hand washing, right? So that was one of the things that was mentioned. But hand washing involves a number of behaviors, right? It involves cleansing your hands, right? And there can be other ones, using protective clothing, cleaning and disinfecting surfaces, maintaining isolation. All of these are sort of behaviors that you could potentially address, and each of them could be defined more specifically. So for example, if you take hand hygiene, right, what do you actually want people to do? You want hand hygiene practices to be followed in all opportunities identified by whatever guidelines that you have, right? And this is done. Where does that happen, right? You want people to do it on the hospital wards. And who is involved in performing the behavior? So let's say we're focusing on nurses here because we think they have the most contact with patients, right? So now you know that for your qualitative research, or when you figure out what the barriers are, you're going to focus on nurses in the hospital wards and trying to get them to do a specific behavior, wash their hands, right, at any opportunity that's identified by the guidelines. Right? So once you've kind of identified the behavior that you're going to focus on, right, the next step is to figure out, which is the exact target behavior or one or more that you're going to focus on. And it's important to remember behaviors don't occur in isolation, right? So often people are doing a behavior in relation to other behaviors that are occurring around them that are influence whether or not they have the ability to perform the behavior of interest. So for example, for nurse hand hygiene behavior, that's going to be impacted by whether or not senior doctors wash their hands, right? If nurses see that these senior guys walk in and walk out, they may be less likely. Why do I have to do it too? It's going to be influenced by patients. If a patient says, don't touch me unless you wash your hands, maybe they'll go to the sink and wash their hands. Hospital staff ensuring that gel is available in dispensers. If there's no gel there, then they're not going to wash their hands. So the point of going through this exercise of thinking about what other behaviors might influence your behavior is that now each of these is a potential target for intervention in order to achieve your target behavior of nurse hand hygiene, right? You may decide that after further research that actually, this has a huge influence on whether or not nurses do that, so we can target our intervention here. Or that, really in our hospital, the gel dispensers are always empty, so we really need to figure out how to make sure that these are full, right? So in different contexts, different barriers might exist, right? Depending on. So it's really important to think about what are all the potential. Doing this will help you think about what are all the potential points of intervention that you might have in order to fix the target behavior of interest. So this is an example of considering all the potential target behaviors. So this is an example from the Behavior Change Wheel book where their goal was to reduce residential home energy consumption. Okay, so they hired a consultant to go figure out what are the different things in the home that can be done to reduce energy consumption. And it was a huge. Their goal was to they identified 231 different behaviors, right, that could be done. Right? These are all potential targets that you can select from. Right? 187, most of them were related to reducing electricity, some to actually producing electricity on site, and others related to kind of construction and retrofit options. Right? So the point is, if you really think about it, it's really, you may have your idea about which one you want to do, but if you really think about the potential universe of behaviors that are involved, it gives you a better sense not only of are you making the right choice, but also what are the other things you might do to reduce other related behaviors that will help you achieve your goal. All right, so how do you pick, right? Once you've generated this list of candidate target behaviors, how do you pick, right? This is where judgment comes in. This is where your knowledge of the context, your interactions with stakeholders, your work in the environment that you're trying to address, all of those, judgment comes in at this step. And what you're trying to do is you want to limit, you can't fix all of these behaviors at one time, right? So implementation is an iterative process, right? You change some things, you reassess, and then you fix, other things that are still remaining, right? It's very rare that everything can be fixed at once. So in terms of figuring out which ones to start with, right, think about the likely impact if that behavior is changed. Right? If you know that if you have evidence or you have data from talking to stakeholders that yes, you think that changing a particular behavior is likely to have a large impact on the outcome of interest, then yes, that's one that it's a low-hanging fruit you should start with first. How easy it is to change, right? Don't make life harder for yourself than it needs to be. If there's a behavior that you think is easier to change, right, that's one to change first. How central is the behavior to the problem, right? So if you have a group of related behaviors, if you pick one, is it also likely to change some of the other ones? If so, if you're going to have that spillover effect, then yeah, it's good to target that one because you may be able to change more than one of them at the same time. And lastly and importantly, ease of measurement, right? If you can't measure it, you can't fix it, right? If you don't know whether or not it's happening, if you can't measure that, then how do you know whether your intervention is actually changing the behavior or not? Right? So pick behaviors that you can actually measure, right? Otherwise, you will have no idea whether or not your intervention strategy is working. Right? So for each of these criteria, right, impact, how difficult it is to change, centrality, measurement, you can just rate, right, qualitatively as promising, very promising, not acceptable, right? So again, this seems unscientific, right? On the other hand, you need to go, it's more of a systematic rather than scientific process, right? It's going through a process which forces you to make decisions and to make decisions based on, reasonable criteria for arriving at, a starting position for implementation rather than doing it randomly or by your best guess. All right, so again, let's start by listing the target behaviors for improving hand hygiene, right? So related to equipment, we can talk about keeping sterile single-use items and packaging, sterilizing medical equipment, handling sharps. Related to patient care, removing catheters and indwelling lines when they're not needed. For the hospital environment, making sure that cleaning furniture and bed linen. And then, there's hand washing and ensuring availability of gel and wearing protective equipment, right? So if this is a long list of target behaviors, you can go and rate them, right, simply in a table. And this is what we're going to ask you to do in some of the exercises later this afternoon, right? So what's the impact of cleaning hands? We think that that's actually a critical thing based on some evidence that we know that hand washing is really important to infection rates, right? So we think that doing that would have high impact. How easy it is to change it? Well, maybe it's not the easiest thing. If it was so easy to change, then it wouldn't be a huge problem. But we think that it's likely that at least there's a possibility of changing it. If spillover effect, yes. If nurses are doing it, then maybe it's more likely the hospital, then senior doctors will do it. Maybe it's more likely patients will start asking if they know that most nurses are doing it. And can we measure it? Yes, we can easily have someone, watch the rooms in the ward, and when nurses go in and out, we can measure how many times they've washed or not washed their hands. Okay. So you can do that for each behavior, and based on this kind of an analysis, you may end up selecting one or more that you can start focusing on, right? And the goal here is to start with the things that you think are most likely to have an impact, going to be easiest to measure, and going to most likely to kind of be related to other behaviors. So once you select the target behaviors, you want to be as specific as possible about what it is and where it's happening. Right? The more precise you are, again, the easier it is you can figure out what it is that's preventing that behavior from happening. Right? So if you had a behavior of eating less, right, if you try to sort of think about what you actually want people to do, right, cutting out snacks between meals, substituting fruit for cakes or sweets, it's much easier to figure out why, or what are the reasons people aren't cutting out snacks than just to say eat less, right? It's very hard to sort of figure that out. So again, you want to specify this in detail. So in terms of how do you specify it, and the central things you need to answer are who needs to do what differently, when, where, how, and with whom. Meaning, is it a behavior that occurs in isolation, or is it something they do with other people involved, right? So for example, there's a published recommendation that cognitive behavioral therapy, CBT, right, it should be available as a treatment option for schizophrenia, okay? So that's actually, this is the problem with guidelines, is that they're written like that. What does that mean, right? How do we actually implement that? If you think about using this behavioral specification approach, you may say, what should health providers actually do. They should offer CBT to everyone with schizophrenia. Who should be doing it? Any health professional responsible for offering treatment options to psychiatric patients. Where should they do it? In secondary and tertiary care centers. And when? Right? When they're formulating a care plan with that patient. Right? This helps you to understand exactly what should be happening, and you can then measure, where things are breaking down and why. So for a hand hygiene example, we want nurses to wash their hands. When and how often? At the start of each shift, after using the bathroom, every time before entering a patient room, and every time after exiting a patient room. Right? So now we know how to measure this, right? Whether or not it's happening. Where on the hospital wards? What do we want them to do? Rinse with gel and air dry. And this is not something they're doing with anyone else. They're generally washing hands by themselves. Okay? So to summarize, right, we're going to define the problem in behavioral terms, list out all of the potential target behaviors, and then select them. And then once you select the ones to address, you're going to specify them. So I'm going to go over one example of this. And so what is the evidence practice gap here, right? So I wrote low rates of early infant diagnosis. So what are some of the behaviors that might, how would you, before getting into it, how would you just define this in behavioral terms? What do you actually want people to do to reduce rates of early infant diagnosis? Or increase rates, sorry. I just wrote they need to test at-risk infants for HIV, and then they need to treat them if they're positive. Right? That's kind of what you want them to do. Right? Now we're going to get into specific behaviors. Right? So I think you mentioned one. They need to counsel mothers to come back to get tested at a certain time. Or the behavior is, I hope I got it right, it's test at-risk infants for HIV and treat them if they're positive. What needs to happen? Okay, we need to counsel them to come back at 6 weeks, and then what else? One general approach to figuring out the candidate behaviors, I learned this from Luke, he does this really well, is you just take the guideline, right? And what does the guideline tell you should be done, right? So last night, I just looked up the early infant HIV diagnosis guidelines, and these are the things, many of which you guys said should happen. And maybe there's more than this, but this is just a place to start. It said, you need to provide counseling to the mother about the need to test the infant, right? They need to bring the infant back to the clinic at 4 to 6 weeks, right? At that point, the health worker needs to collect a sample and perform virologic testing, right? The health worker needs to provide the results to the mother within 4 weeks. That's what the guidelines says. It's not the mother's responsibility. The testing place has to go and call them, figure out how to contact the mother and contact them. Then the mother has to bring the infant to the clinic to initiate treatment if the test result is positive, right? And then they're supposed to collect a sample and repeat virologic testing to confirm that the test is indeed positive, right? So based on the guide, these are the minimum behaviors that need to happen. I think some of the other ones you guys mentioned are also sort of relevant. But I think one approach to kind of specifying candidate target behaviors is to just think about what the guideline or recommendation, what are all the series of steps that need to happen. Right? Sometimes the guidelines don't spell that out, like I showed you with cognitive behavioral therapy. But in your mind, think about this as a process. To deliver cognitive behavioral therapy to patients, what are the things and steps that need to happen, and which people need to do them? Okay. So, what do you guys think about which of these behaviors? I just abbreviated them as counsel, bring to clinic, perform testing, provide results, bring for treatment, repeat testing. Which one should we focus on? And again, we're going to decide this by thinking about the impact if we change this behavior of whether or not early infant diagnosis is likely to happen, the ease of changing the behavior, possible spillover, so if we change that behavior, are others likely to change, and then can we measure it, right? All right, so in terms of once you've selected the target behavior, then we're going to specify it. So who needs to perform the behavior? Here, I said the counselor. I have no idea if that's right or not. What do they need to do? They need to counsel every HIV-infected mother and their partner, if available, about the need for testing the infant and when. And then they need to do it during all, I would say, again, if they do it at every PMTCT visit, maybe that's not right. Where do they need to do it in the clinic? And they often, throughout pregnancy, at every visit. And with whom? It's the mother. So this is not something that they're doing on their own, right? It's not their own behavior. They actually need the mother and the partner to be present to do the counseling, right?